Hi friends, we have initiated a series called as Unplugged on the Damn Silly channel on YouTube and Damn Silly page on Facebook, where we try to look at a disease from its integrated perspective. That means we try to look at the disease from the pathogenesis, from the microbiology aspect, as well as from the clinical aspect. Today we have selected a very important disease from tropical point of view, like it's a tropical disease. In India it's very important, and as a physician you are supposed to be aware of that. And that disease malaria, and about which we'll talk about with a very important expert today. We have with us Dr. Surya Kumar. He's going to talk about the microbiological and the clinical aspect, and I will show you the radiological aspect of the disease. So let me invite Dr. Surya to talk about the disease.
Discuss about a very important case of tropical medicine, malaria, as Dr. Sumit told. I'm going to give the case history. A female patient aged 22 years was diagnosed with infection of Plasmodium falciparum malaria. She experienced fever, chills, and serious mental changes and involuntary movements. By physical examination, deep reflexes are hyperfunctional and there is no meningeal irritation can be found. We are strongly suspecting this is already a case of malaria case and sudden CNS involvement. We are strongly suspecting cerebral malaria. So to confirmation of cerebral malaria, we need to do some investigations. The first and foremost, we are going to do imaging techniques. I'm going to discuss, Dr. Sumar sir is going to discuss about imaging techniques of cerebral malaria.
Thank you, Dr. Surya, to give me the opportunity to discuss the radiology. So now we have a patient who is endemic of already a known case of malaria and is presenting with neurological deterioration. And we are suspecting cerebral malaria. The investigations in radiology, we will do a CT and a MR, but usually the radiological findings in themselves are non-specific. You may have diffuse cerebral edema, or because of the sequestered RBCs blocking the capillaries, you may have areas of ischemia, areas of hemorrhages, or you might even see white matter abnormalities bilaterally. So this is the spectrum of diseases. So it is very important to look at the history before we suspect cerebral malaria. Radiology alone cannot make a diagnosis. But this is one of the typical CT findings of cerebral malaria, where you can see the bilateral thalamic white hypoattenuation on a CT scan. Another finding which is possible in cerebral malaria is the cerebellar. You can see the cerebellar hypoattenuation here, cerebral hypodensity here. This is very typical of cerebral malaria. When you do a MRI, one is the FLAIR image, one is a T2 weighted image. You can see thalamic hyperintensity even on a FLAIR and a T2 weighted image. If there is an infarction, you might see abnormalities in the brain cortex, like you see in this patient on a diffusion weighted MRI, which is telling us that there is an infarction. So important thing is that the capillaries and the vessels, the veins, they get occluded by the RBCs. They may lead to infarction, but they can also lead to areas of hemorrhages. So when we want to see hemorrhage in MRI, we use a technique called as susceptibility weighted imaging, where you can see in this patient with cerebral malaria, you are able to see multiple petechial hemorrhages seen as low signal on a susceptibility weighted MRI. You can also use gradient echo to look for this kind of findings. So in a nutshell, the radiological finding in itself are non-specific. We need to look at the clinical picture, look at the patient may have some travel history to an endemic area, or in this case we already knew that the patient is already having malaria and then got deteriorated and we thought cerebral malaria. And the imaging findings would be a combination of maybe diffuse cerebral edema, areas of infarction, areas of hemorrhages, and edema. So that is what we are looking at, and this is the spectrum of findings possible. Now I'll invite Dr. Surya to come and enlighten us about how to further and diagnose this patient.
Sumit for giving the opportunity to discuss about laboratory diagnosis. As per any organism, the first and foremost is microscopy. More than 100 years till today, the gold standard test is microscopy for diagnosis of malaria. We are doing thick smear and thin smear, and you are all aware of that. We are doing with Jaswant Singh Bhattacharya stain or any Romanovsky stain. The diagnostic of Plasmodium falciparum is demonstration of multiple ring forms, occult formation or boat or banana shaped gametozoid. This is the diagnostic. If you are able to see any one of in the peripheral blood, you can confirm it is due to Plasmodium falciparum. But sometimes the sensitivity will be little less. We cannot see if the parasitemia, the load is less, very difficult to demonstrate these things. Next level is advanced version of microscopy, that is called fluorescent staining. We are using QBC, shortly we call quantitative Buffy coat analysis. We are using acridine orange stain. We can demonstrate the structures here. See gametocytes, all the things, very small fluorescent things are banana or boat shaped gametocytes. And another technique is called Kawamoto's technique. This is also using acridine orange stain. Next to fluorescent microscopy. Yes, this is very best, very rapid diagnosis and life-saving test. One is called parasitic lactate dehydrogenase (PLDH) and parasite aldolase detection test. This is common to all Plasmodium. You can say it is a Plasmodium genus, but next one is called HRP2 detection. Plasmodium falciparum HRP2 detection, histidine rich protein 2 detection is very specific for Plasmodium falciparum. So here the one test, it can detect both the things, whether it is Plasmodium or it is Plasmodium falciparum. Very matter of 10 minutes we can diagnose. That's the advantage of this test. And one more thing, you can take CSF, urine, blood, and there are many specimens we can use it for this test. Next is the higher end test, molecular diagnosis, DNA probe and PCR. It high sensitive, high specific, and mainly used for diagnosis of drug resistant malaria. Next is after diagnosis, treatment is important. The management, the traditional treatment is parenteral quinine for cerebral malaria. Then we can follow artemisinin derivatives. So to get this kind of educational integrated medical videos, please follow us on DAMS Delhi channel on YouTube. Thank you very much.
Little editing will be required.
Yes.